Okay, today we're going to be placing an TSI implant into the lower first bicuspid area. And the first thing we want to do is we want to take with our forefinger, we want to palpate the lingual, and especially if we'll be placing one in the molar, because we'll have sometimes a larger undercut back there. So we want to palpate to make sure that we can feel the undercut and how much of an undercut there is, so that when we start drilling, we might want to slightly angle our drill away from that undercut area and keep it in the center of the bone. So the first thing we're going to do is we're going to mark the spot about 3 millimeters away behind the adjacent front tooth, and we're going to mark it with a high speed and drill into the bone till you hear it kind of crackle like that. That tells you that you have an indent, and we've marked the spot. The next thing we're going to do is go down with our pilot drill with the drill stop on it, and we'll drill at least 8 millimeters into the bone. With the drill stop in place, we're going to go 8 millimeters into the bone. Up and down. Okay, that was step number 2. Step number 3, we're going to use a paralleling pin to see if we're positioned correctly. And our assistant is placing the paralleling pin. We're going to look at it, and I'm going to ask her, how does it look from your position?
Looks centered.
And it looks centered from mine. And it's about 3 millimeters away from the tooth in front. The base of the paralleling pin is the same width as the actual implant. So we know that we're going to have a pretty well placed implant. We can even close the jaw and have some idea of what that implant is going to look like when it's in place with the abutment in place. This is a little long, so if we were actually going to be placing this implant and putting a solid abutment in it, it would have to be probably a 4 millimeter abutment, or we might have to shorten the abutment. Now we're going to remove the paralleling pin. And the next thing we're going to use is a tissue punch. The tissue punch should be rocked back and forth slightly and all around, because the bone will never be perfectly flat, and we want to make sure that we go all the way through the soft tissue and cut the periosteum away from the soft tissue with the tissue punch. That way it'll be much easier to remove that little plug of tissue. The plug does not come out with the tissue punch. You can use the high speed and just go around and remove the tissue plug. Now we're ready to use the platform positioner, which is aligned right down the line after in the kit, or the countersink. And we're going to go down with that until the blades are well below the soft tissue. How do the blades look? How does it look on your side?
It looks like they're under.
Okay, the blades are totally below the soft tissue on both sides, on both the lingual and the labial. We're then going to have to go back in with the pilot drill. Now the pilot drill has a stop on it that will go down to the bottom of the countersink hole because it's slightly angled, the stop is. So that we'll be assured that we'll be down at the final depth. Okay, it stops out at the bottom of where we drilled the platform positioner, and now we can go with our final drill. Now, if we're in real dense bone, and you can blow that away. Yeah, that's good. If we're in real dense bone, we're going to go to the 4 final drill for the mandible, which is slightly larger than the one for the maxilla. And we're going to take it down the final depth. If the bone is very hard, we can also use an intermediate, any of the drills that are smaller intermediately. I meant to also point out that, use your air and blow that away. We have a drill stop on the final drill. This also has an angle right there at the bottom that will fit down into the countersink hole and make sure that we're down to the bottom of the osteotomy. At this point, the preparation of our osteotomy is complete, and we're ready to just place the implant. TSI implant. Janet is carrying it to the osteotomy with the cap and screwing it into place. Now you can remove the cap. And drive it in with the ratchet. And the driver. Would you hold that model? Yeah. Of course, this model material is much harder than the type 3 probably bone that we'd be experiencing, or type 2 in this area of the mandible. Now we're just about down to where we want it. You can see the edge of the embedded tapered platform is far below, or the top of it as far as below the gingiva, at least a half a millimeter or a millimeter. So that when we put in our final crown, it'll be below gum tissue. Next we're going to use a debriding burr or a cleanup burr and place it on top of the implant, and it can be used with a thumb wrench to clean up the soft tissue, and actually if the implant is an angled bone, it'll actually clean away any bone that's up over the top of the platform of the implant. It can be used both with a thumb wrench, or it can be used in a handpiece by using a driver, putting it on a driver, and moving it around. You can see I can move that around and will not damage the top of that implant. It's designed to just clean it up and clean up the soft tissue and and any bone that might be around it. Now you can see how it cleaned away the soft tissue. Okay, now we're going to put our solid one-piece abutment into the TSI. There we are, screwing it into place. And it'll be torqued to 35 Newton centimeters. Now when placing a solid abutment in, it cannot be put into place and then removed, because of the tapered interface. It will lock into place. And to assure final tightness, the 35 is 40 Newton centimeters. Okay, we're going to put our trip, our tissue retraction impression pickup into place. The holes on the side go interproximally so that when we inject medium-bodied or soft impression material into the trip, it'll flow and fill up any interdonal spaces. And then we take a conventional impression on top of that with the hard body.